This program is sponsored by
Lanka Hospitals. Caring, curing.
Good evening, ladies and gentlemen. A warm welcome to MEDILINE once again on Art Television. This is where we focus on the importance of health, on the current situations where medical illnesses, where medical treatments are concerned, and we don't do it just off the book. We actually do it with some of the best experts in Sri Lanka. Some of the best doctors, some of the best surgeons all join us on this program to share their expertise, their experience in terms of technology, in terms of know-how, and in terms of what we need to, as the community, look out to. In fact, today I have with me a very special guest. He's a transplant surgeon who qualified here in Sri Lanka from the University of Caledonia, but also spent quite a lot of time in the UK and Australia, and now it's back in Sri Lanka, the motherland, to take through, of course, surgeries. He'll be talking to us about the importance of the surgeries carried out and many other things that are important for society itself to get to know about. So I'd say good evening to Dr. Ruwan.
Good evening.
Dr. Ruwan Dissanayake is joining us, a transplant surgeon well known to everyone here in Sri Lanka. And Doctor, starting off the program, when we talk about surgery and transplant, we know there are a lot of taboos involved in it. We'll be talking about that a little later, but we'll start off by asking you about your expertise and your experience when it comes to different transplant surgeries in Sri Lanka.
Well, yes, my area of expertise is on abdominal organs transplantation, that is liver, kidney, pancreas transplantation mainly. As we all know, we have a big problem in Sri Lanka. Organ failure is a significant health problem in Sri Lanka. I mean, our annual health statistics shows more than 2,000 people die of kidney failure in Sri Lanka in a year. If you see the liver failure, this what we call cirrhosis, there are again about 2,000 people die every year. So if so we can assume at least 5,000 people die every year in Sri Lanka because of organ failure in a year. So there are 5,000 Sri Lankans dying every year because of this deadly health problem. The only treatment for organ failure in the modern era of medicine is transplantation. If you consider kidney failure, that has been a big problem simply because of high incidence of diabetes, high blood pressure, and there is something called chronic kidney disease of unknown origin, which is prevalent in the northern and the northern central parts of the country, largely based in agricultural fields. So for this problem, the only long-lasting solution, for example, kidney transplantation, you have two options. You can go on long-term dialysis or transplantation. Dialysis has been a very expensive health procedure, whereas a transplant will give you a good quality, healthy life of at least 10, 15, 20 years. So transplant in general is a life-saving procedure, I would say.
Right. Doctor, when it comes to your expertise, now you spend time overseas, you spend time in Sri Lanka. It's true we are very different socioeconomically, but in your expertise, from the time you graduated to now, how have you seen the rise of these problems? I mean, has it been on a very rapid level? Is it otherwise comparatively rising? If you could shed some light on that first.
Yes, if you see annual health statistics released by the Ministry of Health, that shows around 2,000 people, between 2,000 to 2,200 every year in Sri Lanka due to chronic kidney disease, rather kidney failure. The chronic liver disease, the death rate has been slowly yet constantly increasing every year. Now it's going to be more than 2,000 deaths a year. So for all the reasons, known and unknown reasons, the incidence has been increasing. There are once an organ has failed to a significant level that will not allow to sustain life any longer, the patient needs a transplant. There are another option, I would say.
Now, doctor, when we talk about statistics, I believe that from the side of the medical side, rather, as doctors, you all are more privy to information of this sort. So when you look at the statistics that have come into the recent past, what would you say are actually the levels when it comes to transplants, the different types of transplants? If you could just explain that to us.
Yes. In Sri Lanka, both in public and private sector, kidney transplantation has been available for Sri Lankan patients over last 2-3 decades. However, over last 10 years, there's a significant increase in the number of transplants, the service provided for the public of Sri Lanka. In the public sector itself, there are more than 300 kidney transplants being done a year in 10 to 12 hospitals all around the country, starting from National Hospital, Kandy General Hospital, Teaching Hospital Karapitiya, Teaching Hospital Anuradhapura, likewise. And at the same time, there are few hospitals in Colombo perform kidney transplantation in the private sector as well. For example, Lanka Hospital being a leading hospital, a pioneering hospital in developing kidney transplantation in Sri Lanka. Lanka Hospital has performed more than 1,000 kidney transplants by now. So, which means this service has become a routine practice in Sri Lanka. It's not a unusual or rare service anymore. For example, at least 6-7 transplants done a month in Lanka Hospital, maybe even 10-15 a month. So there are two options you have for transplantation. Like a healthy person who is alive can donate an organ and have a transplant. That's called live donor kidney transplantation. Or if you have a healthy person who is dead on a ventilator machine in an ICU, we call it a brain dead donor. That is called deceased donor organ donation. That's also an option from which we can produce a kidney transplant. So the necessary expertise, the necessary technology, everything is there in Sri Lanka. Good old days when we were medical students, I would say, people are talking about going to India or going overseas to get the transplant. Fortunately for the public of Sri Lanka right now, kidney transplantation is freely available in both public and private sector for the benefit of our people.
So, doctor, my next question will be on Lanka hospitals itself. As we know, it's a hospital, a healthcare facility, which is much looked at, not just by the Sri Lankan patients or the Sri Lankan audience, but also we've got a lot of people coming from overseas for their treatments, for their surgeries in Sri Lanka. When we talk about the technological aspect, the aspect of facility, how has that been a supportive point, or how is that a supportive point to someone who has to get a transplant done in your expertise of working with Lanka hospitals?
In order to have a good transplant program, you need to have best of the facilities, I would say. Transplant service itself, I can categorize into 3 stages. Pre-operative, that means before the operation, which includes preparation of the donor and the recipient both. Lanka Hospital has got all the facilities, for example, all the laboratory investigations to assess the recipient and the donor both. There is there are lots of investigations that you need to do to assure that your donor is suitable for organ donation, and at the same time your recipient, the transplant patient, is fit enough to undergo transplantation. And there are certain imaging studies, I would say CT scan, likewise there are radiological investigations that we need to do. For example, to assess the donor, you need to do what we call a CT scan, and at the same time we call it a CT angiogram, and at the same time there is something called DTPA scan. So all these facilities to assess the donor are available in Lanka Hospital, and at the same time the donor and the recipient both should be assessed to confirm that they are fit to undergo a major operation. This is a major operation. For example, donor operation will take about 2 to 3 hours, and the recipient, the transplant patient, the recipient operation will take about on average of 3 to 4 hours. So we need to confirm both patient and recipient are fit enough to undergo operation. The Lanka Hospital has got all the facilities to perform a safe kidney transplant operation, and the hospital has got best of theatre facilities which would provide a safe transplant surgical procedure. The best of the technology, instruments, and all the safety measures for the best of the outcome. All the facilities are available right now at Lanka Hospital. That will ensure you will have a successful kidney transplant, that which will give another 10-15 years of good quality life. The end of the transplant operation is not the end of the service, I would say, because the care of the patient will be almost lifelong, because the patient will be on what we call immunosuppression drugs to prevent rejection of the transplanted organ. So the patient will be followed up frequently by our physicians and the nephrologists, especially on lifelong. So for the follow-up, outpatient special clinics, and there's special kidney transplant center to look after the welfare and well-being of these patients.
Right. Thank you, doctor. That was very interesting, because I think this is a very different line when it comes to, medical speciality. It's something very intricate. It's also something that people actually need to be educated about, from the traditional know-how of the fear of going under the knife to exactly what facilities that we have today, that we can actually quite comfortably and confidently even have to proceed with such procedures. So with that, ladies and gentlemen, we're going to take a quick break, and on the other side, the latter part of it, we're actually going to delve into how these surgeries work, a little more insight to them in Sri Lanka, and also things that the general public should look into and be aware of. If you just joined, this is Medline with Art Television, and we are here with Dr. Ruwan Dissanayake, who's a transplant surgeon, and he'll be back on the other side to answer a few more questions with us, so do stay tuned.
Lanka Hospitals. Caring, curing.
This program is sponsored by
Lanka Hospitals. Caring, curing.
We're back on Art Television with MEDILINE, and we're on to the final part of our show today. We've had the pleasure and the company of Dr. Ruwan Dissanayake, who's explained to us the important aspects rather of transplant in surgeries and things that have developed, especially in the Sri Lankan context, both in private and public sector. And Doctor, the interesting part that we're going into is, could you tell us a little bit about this surgery as we delve into it, as we go very deep into these transplant surgeries? Could you elaborate a little more for us?
The whole treatment procedure of transplantation involves two operations. The operation for the donor, where we retrieve the kidney for the donation, and also the transplant recipient's operation, the patient's operation. donor operation usually with after in detail assessment of the donor, the treating doctors, treating clinicians will take a decision which kidney will be donated. For example, whether it's left or right, because the priority is given for the welfare and well-being of the donor. Donor is number one. So this operation will take about, in general, 2 to 3 hours, and there will be a cut along a rib on that side of the body. There are two options, actually speaking. Like, that's what we call open approach, and there's the well advanced better way of doing is the laparoscopy, that is called keyhole operation, through which there are very small cuts and you will take the organ with a separate incision. And the transplant recipients or the patient's operation, now the donated kidney should be transplanted into the recipient. Both actually in the live donation happens simultaneously in 2 different operation theaters. Both surgeries are started at the same time, and once the kidney is retrieved from the donor, the kidney will be transferred to the next operation theater where the recipient is being operated, or the surgery has already been started. Kidney transplantation essentially happens, your native kidneys are usually placed in the loin, what we call a loin part, on both sides. The transplanted kidney will be transplanted on the lower half of your body. You have 2 blood vessels from your tummy that goes into your legs, the 2 main blood pipes, and there will be blood pipes bringing blood back to your heart from your lower part of the body. Let's say, for example, the priority generally on right side you do the kidney transplant, the 2 blood vessels, you have what we call artery and vein. Artery is the one which brings blood to an organ, vein is the one which brings out of the organ. So both essentially it's a connection of blood vessels. The artery and the vein should be connected to the blood vessels on that part of the body. And then you have what we call a ureter, that the urine pipe which produces the kidney produces urine, then that will be connected to what we call bladder, and then will be excreted out. So the last part of the operation is connection of that urine pipe into the bladder. This is just a simplified explanation. So basically that is the simplest explanation I can give you about the operation. So operation takes about 3 to 4 hours, following which the patient will be sent to the intensive care unit, where all the vital parameters, patients, blood pressure, urine output, breathing parameters, everything will be monitored. Patients will be carefully monitored and managed accordingly. Generally, immediately after kidney transplant, there will be a very good urine output, and there are other parameters like serum creatinine level and serum electrolyte. Like there are certain blood investigation that we will do to assess and make sure the transplant kidney is functioning. In general, the patient will be kept in ICU for 1 to 3 days, following which patient will be transferred to a specialized isolated ward, because post transplantation, all these patients, now this is a foreign organ in your body, so your body's immune system will always try to reject this organ. So therefore all the transplant patients should be on what we call immunosuppression drugs. Those are anti-rejection drugs that you may have to take, you will have to take lifelong to protect your new kidney. Once the patient is capable of looking after himself or herself, which will take about on average about 7 days of hospital care, the patient can be discharged. Once we discharge the patient, we give a long list of instructions, I would say, to protect himself or herself. The number one is, since you are on immunosuppression or anti-rejection drugs, your immunity will be suppressed to a certain level. So we have to protect the patient rather from infections. One important fact I want to tell all the patients who are undergoing transplantation is that you are at risk of infections post-transplantation. So you may have to protect yourself from infections. Like for example, there are certain advice that we give to protect avoid foodborne infections and common cold. Likewise, you may have to protect yourself from those infections as well. Overall, like, it's a lifelong care. It's a lifelong care to make sure the patient has a good quality life and a long lifespan.
Right, thank you, doctor. I think that was very insightful, because sometimes we just see it, on just the surface of things, but knowing the intricacy to it, and when you hear it, I think it's also important, as opposed to medicating yourself for a longer period of time with no permanent and proper solution to living a proper life. As we draw towards the end, doctor, very quickly, I'd like to ask you, when it comes to this organ donor program, let's say whether it was someone who was almost at their last, like is it a patient who's brain dead, or a patient who would like to contribute, how does this procedure work generally? Is it just an openly available thing where they can contact you and they can donate organs, or organs of a loved one who is deceased? How does that work?
Yes, I mean, as a citizen of this country, we all have a certain amount of certain degree of responsibility towards this, because thousands of Sri Lankans die every year in this country. So if you are you have two options. You can become a live donor if you are happy to save another Sri Lankan. It doesn't have to be your relative. You can donate one kidney. Live donation is a very well established safe procedure in Sri Lanka. The next option is what we call donation from brain dead donors, deceased donor organ donation. There are thousands of patients who die, especially from road traffic accidents, like healthy people, and there are such patients who are on ventilator machines in ICUs. We have option of confirming medically and legally the death by means of brain death confirmation testing. If a patient is declared brain dead by medical and legal means, that means the relatives of that donor has the option of donating organs. So I make a public request from all the Sri Lankans, if you have ever an option of donating, if your relative is deceased in an ICU setting, and if the ICU doctors give you the option of organ donation, please help us save thousands of Sri Lankans due to this deadly health problem, I'd say.
Thank you very much, doctor. Thank you for sharing your insights with us. Thank you for taking us even briefly through the procedures where, in layman terms, anyone out there could understand exactly how this is and the importance of it, and exactly how very planned the proceedings of what happens and what comes after. With that, ladies and gentlemen, this episode of MEDILINE comes to an end. Do join us again for more insightful, I would say, interactions with professionals just like Dr. Ruwan into the medical field, its vast developments and its technologies, and of course the best service, the best outcomes, the best health facilities that you could get with Lanka hospitals. We wish you all a pleasant night.
Lanka Hospitals. Caring, curing.